Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Hello, everyone, and welcome to 5 to Thrive Live. I'm Karolyn Gazella, and I co-host this show with my good friend, Dr. Lise Alschuler. Okay, so this month's nutrient profile is low-dose lithium. As it turns out, my guest and I wrote a technical paper for doctors on this subject several years ago. I wanted to revisit the topic and share the information with a much broader audience. And I wanted to talk about the new research, which is actually pretty exciting. So with me is one of my go-to mental health experts, Dr. Peter Bongiorno, who I've worked with over the years. He is considered a leading expert in integrative psychiatric care and is the author of several best-selling books on that topic. But before I bring in Dr. Bongiorno, I'd like to thank our sponsors, beginning with Cetria, a patented form of glutathione clinically proven to raise blood glutathione levels. Glutathione is the master antioxidant and the body's primary defense against free radicals. It also helps support respiratory health. For more information, visit cetriaglutathione.com. Also, Pro Thrivers Wellness Brain, a product specifically for thrivers that contains cognizin for memory, focus, and attention, as well as other brain-supporting nutrients and herbs. You can find Pro Thrivers Wellness Brain online at pureformulas.com. There's also Pro Thrivers Wellness Sleep, which combines higher dose melatonin and other sleep supporting natural ingredients specifically designed for thrivers. You can find Pro Thrivers Wellness Sleep at pureformulas.com. And Dr. Ohhira's Probiotics. It's a best-selling probiotic for more than 30 years, and it contains 12 probiotic strains that are shelf-stable, so no refrigeration is required because of a unique 3-year fermentation process. It's a very effective probiotic. Learn more at drohhiraprobiotics.com. Dr. Bongiorno, it's always a pleasure having you on the show. Thank you for joining me.
Oh, thank you, Karolyn. It's great to be here again.
Yeah, so before we dig in to low-dose lithium, you use an integrative approach to mental health issues. Why is that important for you?
Yeah, well, I mean, what I see is that many people who come into my office are often already on medications. When you define integrative medicine, you're talking about using medicine that combines both conventional medical care as needed along with holistic and more functional medicine and naturopathic care as well, and really using them together for the best benefits of the patient. And most of the patients I see who come in with mental health issues are typically treated with conventional medicine, which sometimes can be life-saving. There's no questions about it, but oftentimes don't really get to the underlying issues. And, there's a lot of physiology that underpins why someone has mood issues, whether it's imbalances in neurotransmitters or other issues that create this mood problem that they're having. And I find that in conventional care, we don't always address the underlying piece. And that's where I think, for me, the integrative approach is so important to me, because a more integrative approach first asks the question, okay, well, there are mood issues. Possibly it's a neurotransmitter imbalance, possibly it isn't, but whether it is or isn't, what are really the underlying issues that are involved with why this person feels the way they do? And I think that's really where integrative medicine brings great value to helping people with mood issues, not only to help symptoms in the short term, but hopefully to also fix the underlying issues.
Yeah, I would agree, getting to the root cause. But I'm glad that you mentioned that integrative medicine also addresses the symptoms, because that can be extremely problematic with mental health. So, okay, so when it comes to low dose lithium, what is it and why is the low dose significant?
Sure. Well, lithium is a mineral. People think about magnesium or zinc as minerals that are commonly known. So lithium is another mineral on the periodic table. It's one of the earliest minerals that kind of came to us after the Big Bang, when molecules started getting together.
Mhm.
And it's important to us because it's something that was used oftentimes starting in the 1950s for patients with things like mania and bipolar disorder, used at very high levels. And it was found to kind of help tamp down some of the mania and the mood issues going on. And as we're learning more about lithium, what we're realizing is that in places where people have higher levels of lithium in the water, what would be considered lower dose levels every day, people are generally happier. And there are actually less suicides in those places, less hospitalizations for suicides. There were studies that were done in the 1970s that confirmed that indeed in environments and water and places where people lived that there were higher natural lithium levels, that people generally um, had less suicide and less mood issues.
Yeah, I mean, I remember when we wrote about that early research, it was very exciting. So let's stay with psychiatric care.
hmm
What are the benefits? I mean, you mentioned reduce suicide, but what are the benefits of low dose lithium, and is there even more research other than that early data to support those benefits?
Yeah, well, now we know that there is research showing how lithium actually affects the brain, right? That we know
Mm.
that there's a couple of areas of the brain, particularly an area called the hippocampus, which is important for memory, an area called the amygdala, which is our part of the brain that looks for threats, and an area called the striatum, which is important for reward. And we know that these areas are particularly well supported by lithium, and we know that lithium as a mineral is very neuroprotective. It protects the neurons from damage. It helps them rebuild themselves. It also helps the neurotransmitters stay in balance. And it even helps our circadian rhythm. So many of us, when we have mood issues, we have trouble sleeping too. And we think that it even can help that. So, as far as psychiatric research for lithium, I would say the first ones I remember were probably dating back to around the mid '80s when it was used for people who who had addictions, especially to alcohol, and they found that there were benefits in using lithium for that purpose. And since then, we've seen a few studies in animals. To tell you the truth, for psychiatric care, there's not a ton of studies, at least not the level of studies I'd like to see, although now the interest is really growing because we are seeing studies not only in animals, but in clinical trials in humans showing benefits for memory and cognition and mood in people with Alzheimer's.
I know I want to talk about that because that's the research that I've been reading lately. But let's go back to psychiatric care.
Okay.
So, in clinical practice, are the primary applications depression and anxiety?
Yes, well, I see it work really well for depression, for anxiety, and also for impulsivity, sometimes even for focus issues. And not only just for adults, but even benefits in children.
Oh, that's cool. So it can be used in children. And you mentioned sleep, and I mean, honestly, anxiety, depression, all of these things that you've mentioned, they do go hand in hand. Poor sleep can magnify, and better sleep can help reduce symptoms. Correct?
Exactly. Exactly. Yeah, one definitely either makes the other better or worse, right?
Yeah.
And I find when I work with a patient and they're having sleep issues, that's usually one of the priorities that I will make with that patient to make sure we help them sleep better because I know if a patient sleeps better, many things are going to improve. Blood sugar is going to will balance, their detoxification system will improve, their brain will repair better. So there's so many benefits when people sleep better.
Yeah, I would agree. So let's stay on how it works because I like the fact that there is research, newer research on how it's working, and I do want to talk about the neuroprotective effects of it because I think that's really exciting. Are there other mechanisms, like in the brain, when it comes to psychiatric care, or is it primarily just because it is neuroprotective?
Well, we also know that it can help the generation of neurons, like young neurons, grow. more efficiently. We know that it helps even possibly protect against other heavy metals. So lithium is a mineral, and oftentimes minerals that are good for us, like magnesium, for example, can help block the effects of toxic heavy metals. So things like mercury and cadmium, and we believe that lithium can also do that as well. Plus, it even inhibits certain enzymes that break down certain proteins that are very important for our memory, which is why we think it's even useful for our memory.
Yeah, that's cool. Okay, so let's talk about other benefits of low dose lithium. So I just read a paper that just came out yesterday from
Yeah, yesterday.
JAMA. Yeah, did you read that? I
Yeah,
mean,
in
from
JAMA
JAMA.
Neurology.
Yeah, I mean,
That's
like, wow.
brand new.
Yeah, so tell us about this connection, and if you have details about that
Yeah.
particular study, tell us
Yeah.
specifically about cognition, Alzheimer's, dementia, and just that area alone. Tell us
Mhm.
about that.
Yeah, well, as you said, hot off the press, right? It came out in
Yeah.
the Journal of the American Medical Association Neurology, JAMA Neurology, yesterday, March 2nd, and it was a new study with uh, patients who are adults age 60 and older, and they had what was considered a mild impairment in their cognition, and they were either given a low dose lithium or a placebo. And if you look at the elemental amount of lithium and what they consider low dose lithium, it was probably around 50-55 milligrams of lithium, elemental lithium. And over the study, which they looked at for 2 years, they found that the patients who received the lithium had less of a rate of decline when they looked at their memory. So they found that people who took it definitely did better in terms of memory. Not that it cured it completely, but that the cognition was uh, it didn't it didn't decrease as quickly.
Right, which that's kind of what I liked about it because these were adults who already had some mild cognitive decline.
Right.
So that puts them at higher risk of developing Alzheimer's or some other issue. So the fact that it delayed further decline, that's that neuroprotective part, right?
Right, exactly. Yeah, neuroprotective, also its ability, what they call neurogenesis, the ability to create neurons, and possibly, its ability to improve the neurotransmitters as well.
Yeah, and it's interesting because I noticed that it's now being called like an anti-aging mineral, which I don't like the term anti-aging. I like healthy aging. But now with this, cognitive benefit, I can kind of see why it's being deemed, a healthy aging mineral.
Yeah, absolutely. And from my perspective, it's Alzheimer's and even now non-Alzheimer's dementia, there's so many facets to it. It's certainly the changes in the nervous system and the brain are important, but also inflammation is a big part of it. Blood sugar imbalance is a big part of it. Certainly, exercise and circulation is an important part. So, if we can have a tool like this that can help work on minimizing the memory changes, then we can work on those other underlying issues at the same time. Because, when we look at this study, they were doing one thing. And I know in my practice, we work on a number of things at the same time. So I
Mhm.
feel that's why, the results can be even better.
Well, speaking of that, I read now this I didn't dig into as much, but maybe you have. I've read that low dose lithium also provides cardiovascular. It can benefit muscles and joints, and it can have other health benefits as well. Is that valid data?
Well, it's really interesting because when you think about it, when you think about minerals, whether it's magnesium or lithium or zinc, the ones we know about have so many beneficial effects throughout the body, what they call pleiotropic effects, meaning it affects so many places that, of course, it makes sense that lithium itself probably isn't just beneficial for one body system. And we know that lithium does have complex cardiovascular effects, that it can help kind of calm uh, like the beating of the heart when it's kind of beating erratically, and it has protective effects even against what they call ischemic heart disease, meaning when the heart isn't getting as much blood as it's supposed to get, it can actually be protective of the heart. So yeah, I mean, and we know the same with magnesium. Magnesium is good for the brain, it's good for the nervous system, it's good for the heart, it's good for bowel movement. It has so
Yeah,
many
yeah.
benefits. So it makes sense that lithium would have similar effects throughout the body too.
Yeah, that's such a good point. I actually wasn't even comparing it to like magnesium, but like magnesium is involved in what, like over 300 different enzyme reactions in the body. And so it's logical that it would, in fact, have other health
Right.
benefits. Okay, so how is low dose lithium used in clinical practice? What's the typical dose? And does that dose change based on the clinical goal? If I'm using it to help my uh, brain from having cognitive decline, is that different than if I'm anxious or depressed?
Sure. I think it depends on the patient. It certainly depends on the age and the weight of the patient as well. I'll typically use anywhere between 1 milligram and up to 20 milligrams of lithium orotate. So sometimes I'll dose higher, as we just talked about that study there. They were dosing around 56 milligrams of elemental lithium. They were actually using the drug lithium carbonate in low doses, around 300 milligrams total, which translates to less than elemental lithium. So when I talk about using lithium, I'm talking about using that what we call like nutritional lithium, like lithium orotate, which is quite a low dose of elemental lithium. And the lithium orotate is anywhere between 1 and 20 milligrams typically. Like in children, maybe 1 to 5 milligrams. Adults, I'll typically start around 5, maybe move up to 10 or 20 depending on the situation. But the general idea is that it's not something that I'm thinking about using. They take it and then that night they have a good sleep, or that day they don't have any anxiety just from a dose. It doesn't work, in my opinion, pharmacologically that quickly. What seems to happen is that as the lithium nutritionally kind of builds in the body, it starts to have a beneficial effect, and that's not something that occurs right away. So I'm less interested in dosing it higher and higher with people, but more interested in dosing it more more consistently.
Yeah, I'm so glad that you brought that up, Dr. Bongiorno, because I think a lot of times people feel like they're going to take a dietary supplement and it's going to work like a drug. And that's not the case, because the dietary supplement, it works with your body, and these things take
Right.
time. So lithium orotate, I'm glad that you brought that up as well, because the lithium orotate is what is the nutritional supplement. That's the form that people should look for. Is that correct?
Yeah, I think that's a good. Ooh, I'm sorry, I dropped my microphone. That is a good choice. A lot of good quality companies will make that, and yeah, so I would say look for that.
Okay, cool. All right, so let's talk about safety. Are there people who should not take low dose lithium? And are there any contraindications or adverse effects that we need to know about?
Sure. Well, looking at the studies of the medication lithium carbonate, again, which is a much higher dose, typically the concerns are thyroid toxicity and kidney toxicity. Now, that's with the drug. In my practice, I will look at profiles for people for thyroid and kidney before we start, just to be sure. But in my practice, after using it for many years, I have not seen one case of someone having any issues with the kidneys or with the thyroid.
Yeah, that's good. And you mentioned that it can be used with children. Is the dose based on body weight in those cases?
Yeah, typically for the little ones, they'll start with maybe 1 milligram, 1 milligram twice a day, so maybe 2 milligrams, and that's for a body weight of maybe 40, 50 pounds, something like that.
So how young can you go? If and so yeah, let me ask that question
Yeah, I
first.
I I would say, if the behaviors are a concern, especially if there's a lot of impulsivity, a lot of anxiety, I think you can, I've worked with children with it, I would say as young as 3 or 4.
Okay.
Yeah.
And I'm assuming that this would also potentially be used for ADHD?
Yes. Yeah, I think as far as ADHD goes, I think there are other that wonderful herbs and amino acids and things that are also exceptional. But I would consider using nutritional lithium, especially if there's a strong picture of impulsivity that goes along with it.
Yeah, or maybe if the ADHD has a little bit more anxiety, or if it has some depressive symptoms as well, perhaps.
Right, exactly. And honestly, I think most cases of ADHD are actually an underlying anxiety of some kind. So I think, yeah, probably in most cases that would be appropriate.
Yeah, that makes a lot of sense. Do you ever combine lithium with other nutrients, herbs, in your practice, or is do you feel lithium, low dose lithium, is kind of a standalone intervention?
Yeah, well, as a naturopathic doc, I think about working at an issue from multiple factors at the same time. So it's very rare that I'll consider using any particular natural supplement as a monotherapy without addressing anything else. So let's say we're working with an adolescent, for example, with impulsivity. We're going to be working on blood sugar regulation, making sure the food quality is very good, making sure that adolescent is getting to bed on time and exercising their body. So we're doing a number of things at the same time to support, best mood. And of course, maybe using lithium, maybe using other herbs that might be calming. So, or maybe certain amino acids that support neurotransmitters. So typically, I'm not just using one substance by itself.
Yeah, it's very holistic. It's very comprehensive. That's what I love about the integrative approach. How big of a role does diet play when you're looking at mental health issues with your patients?
Yeah, very important role. I mean, the data is so clear about processed foods, about foods that are, very inflammatory, contributing to risk. I remember when when the studies of the Mediterranean diet came out in the early 2000s. There was a lot of discussion about how a good Mediterranean diet could both prevent and even treat mood disorders, and that was very exciting because what they did was they started showing how when you ate a healthier diet and inflammation in the body decreased, that you also saw improvements in mood.
Right. I mean, and we talk about, well, you've known Dr. Alschuler for a lot of years, probably as many years as I have, 30. Um, uh, we talk about the
That's about
Mediterranean.
right.
Yeah, I know, right? It's, time flies, doesn't
Oh
it,
boy,
Dr.
I was just going to
Bongiorno?
say time goes by, doesn't
It
it?
it does. I know
uh,
we go way back.
yeah.
But we talk about the Mediterranean diet for that very reason, because it has multiple applications, not just mental health, but obviously we talk a lot about oncology and the immune system and everything else. But there's so many cardiovascular is another where the research is phenomenal.
Yeah.
So many benefits to the Mediterranean diet. So that's great that you kind of look to that diet. Your approach is very individualized, also, though, isn't it?
Oh, sure, absolutely. Everyone is different, and I don't have one sheet or a recipe protocol to hand to people. Say, here, do this, and you're going to feel better. The first step is really just getting to know a patient, and that's why my first visit is an hour and a half, because I really want time to get to know them, and then figure out what tests might be valuable to really look into underlying issues that I'm guessing might be a concern based on the thorough discussion we had, and then really implementing a plan that looks at the factors that we've really ID'd that seem to be the main issues.
Yeah, I mean, I love your approach. That's why I've always enjoyed working with you. You're very science-based and evidence-based, and you bring that into your clinical practice. So your patients are very lucky. So, where can people find out more about you, your books, and your work? Do you have a website you'd like to share, or social media that you'd like to share? Dr. Bongiorno, are you there? Okay. Well, I think we may have lost Dr. Bongiorno, uh, but he is online. He has several books. So it's Dr. Peter Bongiorno, Giorno. Look him up because he is a wealth of information, has published several best-selling books. So if mental health issues are a concern for you, look up Dr. Peter Bongiorno. He's in the New York area, and he is just a wealth of information. So
Thank
definitely.
you.
Oh yeah, there you go.
Sorry about
There you
that. I don't see how my microphone got muted.
Oh, that's okay. That happens all the time,
But
honestly.
thank you.
It happened to Dr. Alschuler just the other day, and I'm like, "Where are you?"
Oh, goodness.
Yeah. So remind us about your website and any other social media that you'd like to send people.
Yeah, thank you. Yeah, I'm on Facebook. I'm on Instagram. Instagram is at Dr. Peter Bongiorno. So please do join me. I love hearing what everyone is up to, and what's new for them and what's working for them as well.
Yeah, for sure. All right. Well, let's stay in touch. I'm sure I'll be inviting you back on the show again.
I would love that. Thank you, Karolyn. Thank you for all the great work you do, bringing
Oh,
people such great information.
well, thank you. And thanks again for joining me and talking about this important nutrient, low-dose lithium. And once again, I'd like to thank our sponsors, ProThrivers Wellness Sleep Formula, ProThrivers Wellness Brain Formula, Cetria Glutathione, the superior glutathione to support liver and immune health, and Dr. Ohhira's award-winning shelf-stable probiotic. Thanks for listening, and remember, you can find past shows at ithriveplan.com or any podcast outlet. We've been doing this now for 14 years. We were doing it way before podcasting was cool. Anyway, may you experience joy, laughter, and love. It's time to thrive, everyone. Have a great night.